Hello, welcome to your medical exam. I hear you haven't been feeling the best. You've just been a little bit stressed and unwell. So I'm going to do a holistic assessment. I want to get a lot of different points of feedback from the body so that we can decide the best course of action to make you feel better, okay? I will be taking notes throughout the exam, so if you hear me scribbling away, that's all that is. Otherwise, feel free to close your eyes unless I tell you otherwise. So tell me when you started to feel less well, a little bit more general malaise, as we might say medically. Okay. So it's been quite a while, been a couple of months. And has it gotten worse at all as time has progressed? Just the same, okay. Are there any times of day that it's worse than others? Feel worse at night, okay. And have you been having any trouble sleeping or getting relaxed and comfortable at night? You have, okay. Are you having any bad dreams with these sort of bad achy feelings? Sometimes. Yeah, often when we have these sort of aches and pains in our body when we're trying to sleep, it's reflected in the discomfort and the stress of the dream. So that's why I asked that. And where is there pain, or is it just kind of achiness? There is some headaches, okay. Is it sort of behind your eyes or more in the top of your head and your eyes? And is it a throbbing pain or a sharp pain? Dull ache, gotcha. All right, thank you for confirming all of that for me. I want to do a few tests just to establish your general health. So first I'm going to take your pulse. So I'm going to be placing this right on your finger. And while it sits there, I'm also going to be counting your respiration. So I'm just looking at your chest rise and fall. 1, 2, 3, 4. So breathing's a bit fast. Okay, let me take that off you. And it looks like your pulse, yeah, its pulse is fast. 85 for resting and just sitting here is a little bit high. Like we'd like to see someone at your age be more in the 60s or 70s for resting heart rate. And oxygen level is 98 though, so you're getting plenty of oxygen, so that's great. Next, I'm going to take your temperature, so just stay still. I'm going to be running this along your head. So there is a slight fever. We wouldn't put it into a technical fever category, but you are 99.1, which is on the high end of normal, but it's not technically considered a fever. All right, I'm going to listen to your pulses and your heart at the same time. You just first sanitize the bell of my stethoscope. want to make sure we don't pass on any germs. Okay. And I'm going to get quite close to you for this, so please just relax. Okay, try and breathe normally. I'm going to listen to your chest now. Just breathe normal. I'm just listening to the heart sounds. The blub, 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 blub. Got the dub, dub as well. Okay, and now I want you to take a nice deep breath. I'm going to move a little bit further down to your chest, okay? And out. Take another breath for me. And out. And another breath for me. And out. And out. Okay. So lung sounds are clear. I am hearing a little bit of that pitter-patter of the heart, a little bit of that high pulse rate. So I am noticing pulse rate, so the tachycardia, just means that the heart's beating a little faster than normal, that we'd expect from someone of your age and fitness level, that's all. It doesn't necessarily mean it's a bad thing. You could be experiencing some white coat syndrome if you're a little bit nervous coming to the doctors, or it could be related to the fact of lack of sleep. So insomnia is a major factor in increased heart rate. All right, I am going to sanitize my hands before I touch you directly. And I'm going to be palpating the head, and I want to just see if there's any lumps or bumps. This is going to be a really good indicator if you have any swelling of the brain or the head, okay? Any pain when I'm pressing here? Okay. I'm not feeling anything too major. I'm just going to feel over the eyes because you said you were having some pain there. Yeah, no, that's okay. That's all right. All right, now I'm going to do a little bit of tapping on your sinuses. So it's going to be on your frontal and maxillary as well as around your eyes, just to get a sense if possibly those headaches are stemming from some sinus buildup, okay? Let me know if there's any pain. Any pain on that side? No, okay. Come up here now. Okay, that's all fine. Me shining a light in your eyes, and just trying to stare at my nose and not stare into the light, please. I come from down all the way up and all the way down. Very good. And just stare here back at the light now. I want you to look at that light and ignore my finger. And then stare at this light right over here. Ignore my finger. And then look at my finger. Okay, and now back at the light. And look at my finger. And back at the light and my finger. Okay. And follow the light everywhere it goes, please. In every direction. I'm looking at the movement of the eyes. I want to look close into the back of the eye now. Now I'm going to look with a magnifying glass all over your face. I'm looking for skin tone, for any major blemishes, bruising, unevenness to the skin. I'm going to turn on the light and do the same thing. Everything looks pretty symmetrical. Let's make a couple funny faces, all right? Take a big smile for me. Clench your teeth. Okay, and lift your eyebrows nice and high. Don't let me push them down, okay? And puff your cheeks out. Good. I want you to stick your tongue out and move it side to side for me. Can you go, ah? Keep going, ah. I'm gonna look with my light, ah. And take a big swallow for me. Awesome. I'm going to give you a couple of things to taste. I want you to tell me what they taste like. So what does that taste like to you? Very good. That's blueberry. Same thing here. Give that a little taste. Okay. Coffee, very good. All right. And now we'll check your nose. So lift your nose up for me. I want to look inside of it. Breathe in one side. Breathe in the other side. Okay, a little bit of occlusion there for me as well, though it's that time of year. Right, I'm going to can you tell me what this smells like? That's right, it's just a little bit of rubbing alcohol, so perfect. Let's move on to your ears. So this is going to start by me looking into the side of your ears. And those look pretty good. Do you have any issues with your hearing? Okay, well in that case I'm going to hit this tuning fork and I'm going to put it on the top of your head. And I want you to tell me what it sounds like and if it sounds the same on the right side, the left side, or both evenly. Try that one more time. Right side, left side, or both evenly. Okay, good. Now tell me when this goes away. I'll put it on this side. Just gonna test how long you can hear the sound in your ear. And now this side. And it's gone. Okay, great. Close your eyes. I want you to tell me if you hear the little puff 1 time, 2 times, or 3 times, okay? Very good. I want to measure you in your face for symmetry, for any swelling. Also don't, so I'm going to come around the head first. I know. Okay, making some notes of this. I'm going to get a torso length, and I'm going to compare this to a leg length, and that'll give us a sense of distribution. Okay, going to go all the way down now. Okay, let's go around one more time. Very good. All right, I'd like to test your reflexes now, so just stay nice and still. You're going to feel a nice tap. Okay, same thing on this side. Okay, I'm going to go down to your knees, your ankles. And the last thing I want to check is your sensation. So I've got a dull and a sharp, and I want you to tell me what you feel when, okay? Good. Here, here, here. Oh, good, that was both. All right. So I think that you're having some trouble sleeping, and that the most likely cause is body aches and anxiety. So these can be caused by lots of different things. So I'd like to do a full workup, but in the meantime, I'll send you over to our meditation expert. She's going to help you work on some holistic ways to get your heart rate down, feel calmer, and really balance out your energy. So thank you so much for coming to your appointment today, and I hope you feel better soon.